All right, everyone, we are going to get started. Thank you for being a little patient there as we gather the critical mass late in the day. So, wow, like this is amazing. I'm so honored to just be part of this and this group. And I was given the small task of wrapping it up today and trying to summarize some of this amazing energy and think about the next steps, think about the research agenda, moving forward for health in buildings. This is not a small task, and so I've invited several of my friends up here that moderated all of our exciting sessions throughout the day to provide some thoughts and some feedback. And I thought that one of the best ways to sort of frame setting a research agenda moving forward was to kind of open up the question a little bit bigger than that. So it was important to start with thinking, how do we even begin to build a framework to guide the future agenda on healthy buildings that integrates all aspects of human health? I'm going to return to this morning and talk about how the built environment cannot be studied by looking at its independent components. It's got to be studied as a whole, just like humans have to be studied as a whole. And I think you started to get a preview of that today. I mean, when people came up on stage, you saw these environments and you said, you're right, I'm not just what I breathe and what I do and what I see. I'm all these things all together. They all influence me. I was thinking back and I was saying, what would I want my day to look like? You know, what's my healthy environment? What's my healthy habitat? And I think it's something like taking my bike to work, using some Jane's slides that sort of showed some healthy commuting options, and going up to one of Joyce's bike lanes that she showed in New York where there's parks all around me. I'm not going to get hit. It's safe. I know that I can do it every day. I would go into Lydia's gardens where she showed these amazing spaces that are surrounding hospitals, that are areas of respite that I can walk to and engage in at any point during my day. And I'd sort of rock up into one of Chris's green buildings, and there'd be a shower there, so that'd be perfect for my long bike ride. And then there's Judy's indoor park of showing this example of a river, a stream moving through the environment made out of stones, and how that really resembled a natural setting. And wow, that drove home the point of saying the zoo and the animals and natural habitats. And I want to be part of that. And then I would look at James's environments of buildings where I could choose, where do I want to work in this building? What interests me? Do I need a quiet space? Do I need my own igloo or, what is it, Swiss office, Anthony, that I can go work in? And then what stairs am I going to take to get there? Right? I'm going to take the big ones right there that all my friends are sitting on. And I'm going to have some times to just collide. What's the phrase? Sort of naturally collide with people and spark off of them. And then finally, I'm going to go into my own little private garden and do some work there, covered by trees. And I thought, wow, wouldn't that be a cool world? Wouldn't that be a cool world? And that is not going to happen if people leave this room and say, I just do respiratory health. I'm on a campaign for the Surgeon General only on physical activity. Right? These are our habitats, and every single layer, every single component is part of the habitat we build. And so a big question I have out for you, and a big challenge, is that look around at your neighbor. You can do it now. Look. If you've not met them, you need to meet them, because they're not actually this person that came to a conference that you don't know. They are now your colleague. And by the way, it's not that person that does respiratory health and industrial hygiene, and I don't know what they're talking about. I do this. That's completely different. Guess what? No longer. It's a we. And I would charge you all that when you hear someone talking about respiratory health and you've been trained to talk about physical activity, you start saying, well, we are studying that. We are doing that. And that's an important message to get across, is that you are not separate in this, and you are the ones that are charged with having a conversation. And so these healthy habitats, there are workplaces, our homes, there are hospitals. I like the phrase healthy habitat. I challenge you to come up with some other phrases that we can start melding this language around. Because habitat, that's where I live. It was brought up 90% of my time is going to be there. If it's unhealthy, guess what? So am I. And you guys are up to building, in my opinion, really healthy habitats. Did I touch something? Probably. It's always my key point. But up to Healthy environments that you can thrive in. I think that thrive is a really positive word about not just living, not just reducing disease, but thriving. This is very important when we put forward an agenda for research to NIH. Why is that important? Because sick building syndrome and respiratory health, that affects a certain portion of the population, and obesity affects another portion of the population. But guess what? When you start changing into a we, those numbers start getting bigger and bigger and bigger, and you say the next grant that goes out, it has to have a collaborative team, and we're after measuring all of these impacts because we're building healthy habitats. This is the power of the research can go there. If you stay in your silos, I don't think it's going to happen. And taking it one more step, a lot of people here study disease. I'm public health. I study disease. Every paper we started with was, here's the big public health problem. Here's how many people are dying from it. So a lot of people here look at risk factors and try to, whoa. Is that better or worse?
There's a little bit of a delay.
Is that just me, or is that the monitor? I think kind of wrapping that point up was just to say people that study disease study risk factors. A lot of people are in this room, they try to reduce risk factors and quantify them. We heard a lot about that. It is the same conversation about quantifying protective factors for health. They fit into the same conceptual model. They are not out there, and so I don't think that anyone in this room can go to the same model and say, oh, that's what I'm studying, that's what I'm studying, that's what I'm studying. So that's also a challenge out to you, and it's going to be a challenge out to our speakers to think about how we pull wellness and health into the same model, because of course we are the same person receiving both sides of that. So I think the only other kind of major points I had, and I'm also stalling so you guys can think of these brilliant sentences they're going to tell me about the future framework. I've charged my moderators to give me one aspect of brilliance. So I'll let you guys figure that out for just one more minute. I do want to say that as we're building this framework, you've got to think new data. We heard a lot about new data today. So our environments, why can't our buildings talk to us? These third skin, oh, they can. They absolutely can. We are building these sensory responses. We are getting new fad gadgets and widgets that we put on ourselves to track. We are volunteering information that is subjective without having to launch a major research study. Google knows this. USGBC knows this. We can capture that data. Scientists are not talking this way, and it needs to be that, I think, moving forward, because we need to map how do we interact, where are we moving in our environments, what are the environments telling us. We can already measure how much are we breathing in one zone. Do you really think we're that far off of measuring all other layers of activity? I think you saw some slices today about how that is absolutely already happening, and I would really encourage that. These are dynamic environments. Keep in mind, you're not just one-stop shop and gone. For designers, I encourage them, just because you build it does not mean that it will work. We have to drive for performance, we have to stick around, and we have to figure out a way to make money and profit by showing you're doing the right thing, and we're gonna stick around until we do. And I'm serious about the actual business case behind these things. It is important that we put it out there. We saw some great talks today about economic models. And then I think about empowerment. I think that'll be my last point here is think about empowerment. It is that we are up to making healthy habitats or other suggestions that we want to use, and that how did you get here? Where are you going to go after this? Did you ask about how healthy this environment is? You just spent your whole day breathing it and sharing that with everyone else, by the way. So you need to start asking the questions. I talk to students, I teach a class at Georgetown, and I've got healthcare administrators, and I tell them it is up to you to be on that design team. It's up to you to ask about safety and health. So you need to change this conversation, and that empowerment cannot be in this room alone. I want you to think right now, 3 people, pause, that you work with, that you interact with, that you're going to tell them, you're going to empower them about this message when you leave. It is literally up to you moving out, and it goes beyond just this group. It's got to be people of all levels, of all different job positions and aspects. I mean, this is not just going to be talking about high-level commercial and hospital buildings. This conversation's got to go way, way beyond that to populations do not have access to this information. We need to empower them. I work in hospitals, and I think years ago we didn't think that we could have this educated patient that came in and knew everything about their health care and was asking questions. Then Dr. Oz came along and said, yes, you are the patient, and here's a book, and here's the questions to ask, and we're getting transparency into our healthcare system. Do you not think this is possible for buildings? Do you not think it's possible to educate someone to say, is this healthy? And by the way, have you done the following things? So those are kind of some wrap-up thoughts of trying to pull together the amazing energy in this room. And I do want to turn it over to my panelists, and I want them to kind of give us some major thoughts, some leaving ideas about where they think the framework is going to be in the future that will be able to pull together all aspects of human health. So I've charged them with doing this in a couple of minutes, if not just 1 minute, and we'll sort of move along the panel, and then please be thinking about your questions and get to the microphone so we can start some dialogue here.